Well, good day to all. My name is Eric Brenner, and I'm happy to be spending some time with you to discuss outbreak investigations. I'll say a few words about myself first by means of introduction. My training is not as an epidemiologist, but rather as a medical doctor, although I've spent most of my time and career taking care not of individual patients, but working with communicable disease control problems at different levels. So, for example, at the state level with the South Carolina Department of Health and Environmental Control, or DHEC as we call it. Also at the national level with the Centers for Disease Control, or should I say Centers for Disease Control and Prevention, since we would rather prevent diseases than control outbreaks once they've occurred. And I've also worked internationally with the World Health Organization, both in Geneva at their global headquarters and also on various short-term consultancies for them. And as we talk about disease outbreaks, I'll have a chance to refer to some experiences perhaps at all of these different levels. I believe you've had the opportunity to look through a case study or discussion of an outbreak of hemorrhagic fever, possibly Ebola, in Uganda, which makes sense since we know that the home of Ebola is in Central Africa. Uganda is more in East Africa, and a few years ago, as you recall, we had Ebola in West Africa, in Sierra Leone and Liberia and Guinea. But that certainly is a dramatic example of a disease outbreak which needed to be investigated. And what we'd like to do today is think through a little bit, reflect on the steps that are needed to approach a disease outbreak. What would one do? What would a health department do? What would you do? Or what would you and your colleagues do when faced with an outbreak? Notice I say you and your colleagues because we'd like to keep in mind that public health is not an individual sport. It's not like tennis. It's more like soccer, shall we say, where you have a whole team and the team works together. So these will be somewhat informal reflections. I will refer from time to time to some of the books on my desk here and to some informal notes that I have. So one of the first questions we should ask ourselves is just what do we mean by an outbreak? And there are actually several ways to think about that question. A commonly used definition is that an outbreak occurs when we have more than the usual expected number of cases of some disease occurring at a certain place and a certain time. Well, how would we know what the normal expected number of cases should be? And that information in public health we get from our disease control surveillance system. So you might say that a surveillance system which lets us tally cases of tuberculosis or foodborne outbreaks due to salmonella or measles or West Nile virus fever or Ebola. Whatever the disease is, the surveillance system which tallies cases over time gives us a baseline against which we can then try to assess whether or not we have an outbreak. That is the observed number significantly higher than the expected number? So that is one way to think about what an outbreak is. We should refine that a little bit more because for diseases that are very common, such as influenza, supposing we were in Columbia, South Carolina in February, and we heard that there were 5 cases of influenza in a high school. Would that be an outbreak or not? And the answer is probably not, because in January or February, that's the middle of flu season, and it's not unexpected that we would have 5 or 10 or more cases occurring in a particular place at a particular time. But supposing you had 5 cases of paralytic polio, supposing you had 4 cases, supposing you had just 1 case, would that be an outbreak? And the answer is yes, because polio has been eliminated from the United States. and the occurrence of even one case would be more than the expected number and would absolutely warrant an investigation. I'll just add parenthetically that as we are speaking now in October, actually November now, 2017, polio is occurring only in 2 countries in the world, in Afghanistan and Pakistan. So if we had one case of polio, that would of course be an outbreak that merited to be investigated. Another question is, how may outbreaks come to our attention? So I mentioned already that one way is just to look at your surveillance data and say, oh my goodness, the number of cases, we usually expect to have 10 cases per month of disease X, Y, or Z. In this month so far, we have 40 cases. That's not normal. Something is going on, so that we can get some inkling by looking at the routine surveillance system. But sometimes things come not through the formal system, but come through communications, which could come from private doctors' offices, from a hospital, where typically the call might come from the infection control committee or the infection control nurse, or as we say now, the infection control practitioner at the hospital. Information might also come from diagnostic laboratories, because after all, they are the ones who are doing in the laboratory diagnostic tests, such as cultures for particular viruses or bacteria. And the laboratory might call up and say, oh my goodness, we usually see 2 or 3 cases of tuberculosis per month, and so far it's only the 10th of the month, we've seen 15 cases. Something seems to be going on. Now, of course, we would hope those cases would have been reported also by the physicians in hospitals as well as by the laboratory, but this illustrates the fact that it's useful to have information from several different sources which you can then put together, and so much of public health depends upon having a network of good information providers. Now, let's assume that there is an outbreak, and we have to ask ourselves now, why do we want to investigate this outbreak? And there could be, well, you might say, well, we want to stop the outbreak, and that would be one reason for sure. But there could be a variety of reasons. So the first, perhaps, is the one that we just mentioned. We want to control the disease, stop the spread of disease, halt the outbreak so that we don't have future cases. We're trying to preserve public health. But beyond halting the outbreak, we also want to do something else, which may be to ascertain the causes of the outbreak. Why did this occur? Because if we can do that, this may help us take measures to prevent a subsequent outbreak, which could be due to the same causes. A third reason for investigating an outbreak may be to learn something. So it's not just for practical reasons to preserve health. It's also to increase our knowledge about the disease in question. You'll recall that last year there was a lot of talk about Zika virus infection in the community, and it was important to investigate not just to try and control Zika, which actually is a vector-borne disease and requires mosquito control and prevention against getting mosquito bites, but we learned a lot from investigating about different modes of transmission. That is, it was not only mosquito-borne, but also could be transmitted sexually, could also be transmitted from mother to child, could also be transmitted possibly by blood transfusions, and in 1 or 2 cases possibly transmitted from person to person as well. So when we investigate, it's a chance not only to stop something from happening, but to improve our knowledge of the disease in question. And as we think then of the steps of an outbreak investigation, let's make a little list, and I think you've had a list proposed for you. There are numbers of such lists. Some give you the 8 steps for an outbreak investigation, and sometimes you see 10 or sometimes 12, and they are all variations on a theme. Let's go through some steps. The list I have says prepare for field work as the first step. Before you're sitting in your office and you're going out to investigate, prepare for field work. establish the existence of an outbreak, verify the diagnosis, define cases, what is your case definition, describe the epidemic, formulate a hypothesis about what is going on, test or verify the hypothesis, refine or reconsider the hypothesis as needed, implement control and prevention measures, and finally communicate the findings. This would be similar to ones that we've seen before. And let's take just a minute or two to think of those individual steps. Preparing for fieldwork. This could involve basic things such as reviewing the literature. I might look up in a book and see, oh my goodness, has this kind of outbreak been described before? Or actually go to the CDC website and look up in the Morbidity and Mortality Weekly Report, the MMWR, and I could see if other outbreaks due to this particular agent, whether it's Ebola or Salmonella or cryptosporidiosis or measles, has been reported. Likely it has, and read through several outbreak investigations and see what people learn from those. And finally, then we have, when all this is done, the last step might be to communicate the findings. And this could be thought of in different ways. So, of course, you want to communicate this to all the partners who've been collaborating with you on the investigation. If you've been dealing with the community, you need to communicate this as appropriate to the community, whether it's people who attend church functions, or teachers and students who attend a school, or the PTA, or in an African village with Ebola, you'd have to communicate this to the village elders and so forth. There might also be the need to communicate this to the press and the media if they've been involved with following the outbreak. That would be very important. And finally, especially if you've had some new findings that could be useful for others in the future, would be to write this up in a formal report, or even in the form of an article which could be published and become part of the literature that future colleagues then would be able to refer to when they were doing their own investigations. Now, in conclusion, let's think a little bit about these steps that I've just been through, whether it's 8 steps or 10 steps. We've been through them sequentially. Now, does that mean that in the real world you have to follow these steps, for step 1 and 2 and 3 and so forth? And the answer is no, because in the real world you have to be flexible according to circumstances. For example, if it seems quite clear almost from the start that infection is due to, or the outbreak is due to a particular restaurant, you don't have to wait till step 10 before you close the restaurant. That might be done early on, even while the outbreak is being investigated. So common sense would prevail there. And I suppose an analogy might be from everyone's experience. Supposing someone gave you the 10 steps to follow when you were given a term paper to write. Well, what are the 10 steps? I'll read you a list of 10 steps. Select a topic, get approval from the professor that the topic is okay, consult textbooks, review the published literature, review authoritative websites, discuss maybe with a friend who has experience in the subject matter, prepare an outline of the paper. Step 8, write a draft. Step 9, review the draft. Step 10, write the final version and turn it in. All makes perfect sense. But in the real world, are those exactly the steps you're going to go through every time? Well, maybe or maybe not. Maybe step 1 might be to attend a lecture which is being given at noon tomorrow in your department. That might be step 1. Or maybe you know enough about the subject to go right to the outline because you did something like this last year for another class. So things may vary. Or maybe as you're starting to think it through, you say, well, my subject is too broad, I need to narrow it. Maybe you picked a topic just to write a term paper about AIDS. You say, oh, that's too broad. Maybe you just mean AIDS as transmitted from mother to child. Or maybe I mean AIDS transmitted from mother to child just in developing countries. So there could be many steps which could change as you go through the process. So in conclusion, I think it's good to have a list of steps. as have been proposed to you, or as you can see in many of these books here. And those steps remain a useful guide. It's a good example of the fact that public health is complex, and it's good to have a guide to the things that we do. But it also points out the tension we have between being organized and structured, and yet have the need to be flexible in what we do. That's something very important in public health. Sometimes we have structure to follow step by step, but sometimes we have to be flexible. And finally, always need to remember that an outbreak investigation is done not on your own, but with a team, and that in public health outbreaks, we work as a team because public health, after all, is a team sport. Thank you very much for listening through.